pre-built audit evidence folder structure. So when we say pre-build your audit evidence folder structure, all of the auditors will use Dropbox. They'll send you a link and they'll ask you to paste all of your folder structure in there. Now, I've said on probably 20 audits. I've had 5 or 6 auditors challenge the provider because they can't find a document. And a couple of those providers got non-conformities for that because the auditor couldn't find it. Now, I knew where it was and I knew how to find it, but the auditor doesn't always know that. So having it in an easy to find structure is really, really important. So separating your core modules, to your SIL module, to your 2A, to your 3, to your 4, to your 5, whatever modules you're registering for. And then in that, have your policy document that sits inside that, and then all of your templates that sit inside that. And then another folder with all of your live versions inside that. So it's all well defined and easy to find. Done for you document pack could save you weeks. Once again, salesman, I'm sorry, I apologize. I'm not a salesman, but you could purchase it and it's all laid out like I just explained. So number 5 is to train and evidence your workforce. So I did speak on a couple of slides ago about our support worker training, which we will talk about. There's a few other things that you need to make sure your team have. So experienced workers aren't the same as evidence workers. So I've had probably interactions with 1,000 support workers in my career, and I've met some remarkable people. Dennis, who works for DSP, who would be on this call presenting this, he's our lead consultant, is actually at a networking event as we speak, so he can't be here. I actually worked with Dennis as a support worker about 12 years ago. And there's a lot of people that get in around in our sector who have life experience. They have years and years and years of career experience in the sector, but some of those people don't have the evidenced qualifications or record of training to prove that they have that skill set. So what's really important is you start collating support worker resumes, support worker first aid, CPR, driver's license, registration of their vehicle, their screening checks, and then any in-house training or external e-learning training you've had them complete or they've completed. So supporting people with accessing the local mental health services. There's a lot of that non-accredited training out there, but starting to collate all of that evidence into their folder shows that they are an evidenced worker. Every participant with a behaviour support plan would have the clinician providing training on that behaviour support plan, such as de-escalation techniques. How do you manage the participant's PRN if they've got one? How do you support the participant to recover from a escalation stage 4? All of these things, the clinician has to train the worker on. Having that evidenced and having a certificate of recognition of doing that training. An OT that might be implementing a new wheelchair for John, they have to provide training on that. So what training happened? Did you record the training? Is there a policy or a procedure on the new training? Is the OT going to give a certificate of recognition for that training? So all of these things build up that worker's evidence to be a skilled worker. Of course, every organisation should have some internal training systems in place, supported decision-making, active support, positive behaviour support, trauma-informed care, medication management, mealtime management, all of those things. As a SIL provider, you must provide support workers, whether they've done it somewhere else or not. They need to learn to your policies. And you must evidence it for all of your staff, your screening checks, certificates on file for each worker, competency assessed, not just attendance, training register with refresher dates, and supervisor competency sign-off. Really important. So I mentioned, once again, not a salesman, but we have the new SIL workforce training package available. We say it takes 8 hours. I've heard a couple of people say they did it in an hour and a half to 2 hours. It's online, self-paced. They can start anytime, finish anytime. They get a certificate of completion. And after each module section, there is an assessment that they must pass. Then you as their supervisor gets their overall certificate of completion with their pass mark on it. Once again, if you buy one of those packages, you get some links to sign 10 or 15 workers up for free.